Hello, welcome back. Today in this video we are going to discuss a common topic which is asked for examination is the Frey's syndrome. The Frey's syndrome is also known as the auriculotemporal nerve syndrome. Auriculotemporal nerve syndrome. A penetrating wound of the parotid gland may damage two nerves. One is auriculotemporal nerve and another one is the great auricular nerve. Now, here I am drawing the diagrammatic representation of two nerves. This is the auriculotemporal nerve. This is auriculotemporal. This is great auricular. And what are the fibers present in these nerves? The auriculotemporal nerve consists of three types of fibers. We have the parasympathetic fibers, then sensory fibers, and sympathetic fibers. Okay. Now, these parasympathetic fibers, this is the parasympathetic, and these fibers are secretomotor to the parotid gland, and the sensory nerves, as you know, they are sensory, and we have the last one is the sympathetic fibers. Okay, so auriculotemporal nerve consists of three types of fibers: parasympathetic fibers, sensory fibers, and sympathetic fibers. Parasympathetic fibers are secretomotor to parotid gland. Then we have sensory and sympathetic fibers. Whereas the great auricular nerve consists of two types of fibers. We have the sensory and pseudomotor fibers. So this is sensory fibers, red color, sensory fiber, and another type of fiber that is called pseudomotor. Pseudomotor supplies the sweat glands. Okay. Now, when the nerves are cut or during lesion, what happens? See, this is the lesion. Okay, so here what happens? When the nerves are cut during the degeneration, the secretomotor fibers of the auriculotemporal nerve grows into the endoneural sheath of the great auricular nerve and makes connection and regeneration in this way. Okay, so when the nerves cut, the parasympathetic secretomotor fibers of the auriculotemporal nerve grows into the endoneural sheath of the great auricular nerve and regenerate with the sensory and pseudomotor fibers. When this auriculotemporal nerve gets stimulated, auriculotemporal nerve is supposed to do the secretomotor function. So what happens when this auriculotemporal nerve gets stimulated? So the stimulation passes through this way, it has to go here, but due to aberrant regeneration, the fibers from here goes here and finally goes to this area or goes to the great auricular. As a result, what happens? The stimulations or the stimulus intended for this elevation leads to the stimulation of the sensory fibers and pseudomotor fibers of the auriculotemporal nerve. As a result, there is the hyperesthesia. When these fibers get stimulated, there is hyperesthesia, and there is sweating. Okay, so this syndrome is known as the Frey's syndrome. or auriculotemporal nerve syndrome. As a result of this syndrome, what happens when a person eats? So what happens? The stimulation of the auriculotemporal nerve, cheeks become red and painful. And when a person shaves, what happens? There is cutaneous hyperesthesia. Hyperesthesia from the ear. So this condition is known as a Frey syndrome. Hope you understood. Thank you.